Hi, I'm Dr. Ryan Stratford, a urogynecologist at the Women's Center. I'm going to speak a little bit about pelvic organ prolapse. Now, that's a term that most people are not familiar with, but it's a common problem. In fact, 1 in 6 women in their lifetime will have conditions of pelvic organ prolapse. Well, what is it? It's a condition after usually childbirth injury that leads to the vaginal walls breaking down from their support and falling down. It can even push all the way out, so a bulge comes out from the vaginal canal. It's a common problem after childbearing from childbirth injury, but it can also occur from a history of straining, including having prolonged constipation and straining hard. So it's not exclusive to just having childbirth. However, let me show you what it looks like. Most patients are not real familiar with what prolapse is, so understanding the anatomy helps. As you can see, this is where the rectum or the canal for passing stool is. This is the uterus. Here's the vaginal canal. Here's the bladder and the outlet to the bladder. They're all in very close proximity. The most common way of describing prolapse I've heard is, my bladder is falling. Well, let me show you what that looks like. It's a condition where the vaginal wall loses its support, allowing it to fall with the bladder right behind it. It's not dangerous because it's not the bladder that's coming out, it's actually the vaginal wall, which is skin tissue. But right behind it is the bladder, which means the bladder has a hard time trying to empty itself, and that can lead to recurrent urinary tract infections, urinary urgency, frequency, and urinary leakage. The problem will progress and it can push out further and further as time goes on. Most people will initially notice this because they're having urinary symptoms, or they see this bulge and they'll want to seek treatment. The same type of bulging can occur on the back wall of the vagina or where the rectum's located, and that looks like this. The problem with this condition is that stool will have a hard time being evacuated because it gets stuck in this area instead of coming out easily. To treat these conditions, we have to recreate that support so that it's back to normal. There's also a condition where the top of the vagina or the uterus itself falls out, and that looks like this. And it can be pretty severe as well. That picture kind of is frightening, and it usually doesn't get to that point before people will notice a problem. Treatment for this includes supporting it with either placing something in the vagina that's left in place on a continuous basis and can be removed once a week and cleaned with soap and water, or once a month by going to see your doctor. It folds up very easily, slides inside the vaginal canal and opens up, and then provides support. There are different shapes and sizes. These are called pessaries, and there are multiple different types. If that's not successful, then surgery can be done. There are multiple ways and options for surgically treating this condition, and it depends on where the prolapse is located, your health condition, and best long-term success associated with the type of prolapse that you have. I would recommend speaking with a subspecialist in urogynecology regarding those surgical options if you have further questions. You can also visit our website at thewomenscenter.com or tune back into my YouTube channel where I will explain a little bit about surgical treatment.